All right, let's talk about something that's a huge deal on the NCLEX, neurological medications. This isn't just about memorizing a bunch of drug names. No, the exam is going to test how you think, how you handle safe administration, what you're monitoring for, and, what you do when things don't go as planned. And let's be super clear about this. Getting these questions right isn't just about passing your exam. It's about proving you have the clinical judgment to keep your future patients safe. Seriously, every point you get right on these questions, well, that's a safe decision you're ready to make in the real world. So why is this topic so stressful for so many people? Honestly, it really just boils down to one thing: information overload. There are just so many drugs, so many different conditions, and a million potential complications. It can feel pretty impossible to keep it all straight in your head. Sound familiar at all? You're sitting there, trying to remember if a tremor is a side effect of the drug or a symptom of the disease getting worse. Which medication needs you to watch their diet? Or, the big one, what do you do first when your patient's condition suddenly changes? These are the exact challenges the NCLEX loves to test, and it's where a lot of people lose points. But what if you had a system to just cut through all that noise? This is where having a structured approach changes everything. I mean, imagine being able to map out this whole category, taking that massive, overwhelming list of facts and organizing it into a framework that's actually clear and useful. That's exactly what we're going to give you a sneak peek of right now. Okay, let's dive right in. We're going to do a quick walkthrough of 4 really critical medication categories. The goal here isn't to teach you everything, but to show you how this kind of framework helps you think like the NCLEX is expecting you to. First up, we've got Antimyasthenics. These are the medications for conditions like Myasthenia Gravis, where the whole problem is this major muscle weakness because the nerve signals just aren't getting through properly. And this is classic NCLEX territory. It's not going to just ask for the drug name. It wants to know your priorities. Are you checking muscle strength? Are you watching their breathing? And here's a big one. Do you know the difference between a cholinergic crisis, that's too much medication, and a myasthenic crisis, which is too little? And what about timing the meds with food to prevent aspiration? Those are the details that score you points. So you get a question just like this one. You see the drooping eyelids, the ptosis, and you hear that weak cough. So what's the immediate danger here? It's all about the airway, right? This question is designed to make you prioritize that respiratory assessment above everything else. Okay, so that was all about an acute situation. Now let's switch gears a bit and look at our next priority: multiple sclerosis. With MS, we're dealing with a chronic, progressive disease. So the nursing focus kind of shifts from managing a crisis to long-term safety and just controlling symptoms. See that shift? Here, your priorities are much more about holistic care. You're teaching your patient how to conserve energy. You're putting safety measures in place to prevent falls. You're on the lookout for secondary problems like UTIs or skin breakdown. It's a totally different mindset for myasthenia gravis. And here's another one to make you think. Is this new weakness just the MS getting worse? Or could it be a really common side effect of the interferon, like those flu-like symptoms and fatigue? The NCLEX needs you to make that connection and do your assessment before you jump to conclusions. All right, let's pivot to our third category: Anti-Parkinsonians. With Parkinson's, the problem is a lack of dopamine, and that's what leads to all those classic symptoms we know: the tremors, the rigidity, and that really slow movement, bradykinesia. So what are we thinking about here? Well, safety is massive, of course, and checking their ability to chew and swallow is absolutely critical to prevent aspiration. But a huge priority, and this is a classic NCLEX trap, is patient education. Knowing that something as simple as vitamin B6 can actually interfere with how well Levodopa works, that's a crucial piece of safety information. Okay, so what about this situation? Your patient says their tremors are getting worse. What do you do? Just tell them to keep taking their meds? Call the provider right away? Or do you assess first? Do you gather more information about timing, their diet, any other symptoms? The best answer, the highest scoring answer, is always going to be the safest and most thorough one. And for our last category, we have anti-seizure medications. The goal here is pretty straightforward. We want to prevent those abnormal electrical storms in the brain that cause seizures. The priorities here are laser focused. You've got to have seizure precautions in place, period. But beyond that, you're constantly monitoring the drug itself. You're checking those serum levels to make sure they're in that therapeutic range, not toxic. And you're teaching the patient about long-term stuff, like why good dental care is so important to manage gingival hyperplasia if they're on phenytoin. Okay, let's raise the stakes. A kid is having a seizure right in front of you, a breakthrough seizure. What is the very first thing you do in that moment? It's not grabbing more meds. It's not even calling for help. Not yet. The absolute #1 first action is to ensure their safety and protect their airway.
Are you starting to see the pattern here? For every single one of these medication classes, it all boils down to a simple formula. It's about safe administration, key monitoring, and knowing your priority actions.
And that's really the whole point, isn't it? The exam coach's method isn't about trying to memorize thousands of little facts. It's about building a mental system, a framework that lets you make those quick, safe clinical decisions when you're under pressure. Just like you'll have to do on the NCLEX and for the rest of your career. You absolutely have to remember this. It's the secret to the whole exam. Every single question is basically asking you, what is the safest possible thing to do for this patient, right this second? When you learn to think that way, you learn how to pass. So what you just saw was just a quick preview of our structured approach, the full in-depth framework that connects all of these dots and gets you ready for NCLEX level success. It's all waiting for you. So are you ready to stop just memorizing facts and actually start mastering clinical judgment?